Welcome back to the Means Report. We certainly appreciate you staying with us, and I really do appreciate my friends Will Martin and his great team at the VA Augusta for helping to set all of this up today. Let's talk about our veterans and suicide, shall we? I know it's a scary subject. Some may consider it off limits, only to be discussed in private, but that's not the case. Elisa Gerardo will back me up on that. She's the suicide prevention coordinator for the VA Augusta Healthcare. And Lisa, just as I said to Dr. Woodley, thanks for what y'all do for our vets. I appreciate it.
Thank you.
Let me just start with this, just kind of to give us a general picture. Who qualifies for your services? Is it all veterans? Is that just the deal right off the bat?
Good question. Well, the suicide prevention program mainly serves to help coordinate additional services within the facility with veterans identified for suicide risk. But within that, we have the ability to have touches with pretty much any veteran in our catchment area.
Okay.
A lot of the ways that folks get referred to us that aren't already getting care could be through contact with the Veterans Crisis Line. The Veterans Crisis Line is open to folks 24 hours a day, and many of the folks that call the Veterans Crisis Line need some sort of a follow-up from their local VA. Those calls come to my team. We do that outreach. We connect with those veterans and help them get whatever care and services they need.
Are you seeing more veterans in recent years who are having suicidal thoughts or tendencies, or maybe you're seeing fewer? Have you noticed any sort of trend?
Mm-hmm. It's interesting because it is generally kind of difficult to trend suicide risks.
Right.
We have seen an overall, over the years, a decrease overall in suicide risk. I mean, a few years ago, the big number was 22 veterans a day are dying by suicide. Mm-hmm. It's down to just under 18 per day. But I think an important aspect of that is that only 7 of those 18 are actually engaged in VA medical care. The rest are not. So one of the things that we've noticed lately is more of a complexity of cases that are coming to our attention. Suicide risk is a very complex situation, and risk factors for any person are as varied as individuals themselves.
I bet.
And so there's not one thing that makes somebody at risk for suicide. So we see very complex pictures that present to us folks that are struggling with not just mental health care, but medical issues and social factors. It could be legal issues, financial issues, homelessness. All of these very complex challenges kind of come together to be this very overwhelming picture that can create suicide risk.
Is most of it, and I know I'm acting like I didn't just hear your answer because you said it varies as individual to individual, but can a lot of the suicidal risks and thoughts be traced back to their military service, or no, it covers everything?
It pretty much covers everything.
Yeah.
Of course, we're going to see some that trace back to military service because veterans are more at risk than the general population. Overall in the United States, suicide is the 11th leading cause of death for everyone. But for veterans, it's the 4th leading cause of death. So there's something different going on with our veterans than the general population.
How do people come to you? Is it somebody knocking on the door or calling and saying, hey, I'm at rock bottom? Or is it a family member? How do they access your services?
It can be any and all of the above. Mm-hmm. But one of the nicest things about the Veterans Hospital system is that we've adopted an approach where we have veterans screened for suicide risk annually, just like any other health screening that would happen when you go to see your providers. And so with this, we have an opportunity to potentially identify folks that are having some challenges and get them connected with services and intervene much earlier.
After that screening has taken place and that intervention begins, mm-hmm. what sort of journey do you take them on? Is it a series of counseling sessions? Is medication involved? What, if someone's watching right now, can mm-hmm. they expect?
Well, again, it's going to depend on the veteran's need.
Yeah.
But there are a cohort of veterans that we identify as much higher risk than other veterans. And these are usually folks that have engaged in suicidal behaviors already. And with that comes a requirement for them to have extra access to mental health care. We want them having additional support to help them decrease those risk factors, increase the stuff that's protective in their lives. And so it could involve medication management, if that's something that's applicable. It could involve various different kinds of counseling to address whatever kinds of challenges they're having.
You know, for a long time, there was, and there may still be, I don't know, help me out here, a stigma associated with suicide. And it would say, shh, let's not discuss that. That's private. Have we made a dent in that stigma where people are more willing to shine some light on this topic?
I think slowly we're making a dent. I think there is always an opportunity for improvement. I think one of the things that is so important for us to start thinking about is we do have crisis lines, we have access to services, but so often what we do is we expect the person that's suffering, the person that's having challenges, to kind of say, oh, I need this, and then take the initiative. And they may not be in a spot where they're able to do that. And that's where family and friends and community really come into play. I really need folks to feel empowered to notice when something's off about their loved one. I think in our families and the people that we're around, sometimes we know with the folks that we're living with that something just isn't quite right with them.
Right.
We don't need to discount that. We need to ask about it. We need to express concern. And we don't need to be afraid to ask if they're having thoughts of suicide.
Right. Better to ask and have the person say, hey, I'm just having an off day, than to not mention it at all and it be something horrible.
Exactly.
I've had doctors and other experts tell me that young people, when it comes to suicide, don't understand that it's permanent. They think this could get someone's attention or it could help change their lives. They don't get it that the switch goes off permanently once someone does that. So my question to you is, with older folks, with our veterans, do they understand that if they ever harmed themselves in that way, there's no going back?
I think with our much older veterans, they do.
Sure.
I think in general, when it comes to suicide risk, whatever the age, when someone gets to that point where they're at a crisis point, the ability to have a rational thought process about it is gone. It's more like a tunnel vision thing. They are so utterly overwhelmed and in so much emotional pain that that's the only thing that they can think and see of as a possible solution.
Makes sense.
And so that's another one of the reasons why I feel like folks on the outside need to jump in and intervene and express concern, because they may be at a point where they can't see other options.
I know that you're going to tell me it varies individual to individual, but can you give me a feel for the timeline from somebody just being in the depths of depression and darkness to a point where if they get help from y'all, start to see brighter days? Can it be days, weeks, months? How long does it take to make someone better?
Well, you're right. I'm going to tell you it varies. One of the challenges about mental health care, and it's probably the same for all kinds of health care, is it's not a passive process.
Yeah.
You know, folks have to be participating and doing the hard work and working on really significant challenges that impact suicide. It's hard. It's hard work to do, and a lot of folks can be hesitant to really go all in. So you can have some variation there. I will tell you, if you're talking about timeline, that from the moment that someone has a suicide crisis to the time that they make the decision to start acting on that, about 24% it's within the first 5 minutes.
Oh my word.
And 70% it's within the first hour. And so it's a very short window when that crisis hits. And so one of the things that we do, we educate families and the community about, is to be preventative for that, to anticipate a potential crisis and create safety measures. And one of the biggest things to do is to have safety measures in place for things that can be used for lethal means.
Is there a way, and getting rid of those things, hiding them?
Hiding isn't good, because certainly somebody will always find them. Getting rid isn't always necessary, but having different kinds of measures put in place that build in time and space between the decision to act and getting to it. So it can be gun locks for firearms, gun safes, having the ammunition in a different place, not having any ammunition in the house at all. All these things would take up time from folks trying to put stuff together to have a lethal access.
Probably my last question, and it's just to ask how the community can help. Should we play the same role that family members do? You talked about how spot the warning signs, sense that something is off, and then we try to get help for that person. Is that the best that we can do for you?
Absolutely, absolutely. I say a lot that it's time for us to get back into people's business.
Yeah.
When it comes to stuff like this, to not be afraid to express concern. 988 is the federal crisis line number for everyone, and it's 988 and you press 1 to get to the Veterans Crisis Line. It's not just the individual themselves that can call. Someone else can call if they're worried about someone and get some guidance and get some assistance. So that's always an option. But expressing concern, really genuine concern for another human really goes a long way.
It does, because sometimes we just pass each other and, you doing good? Yep. You?
Right.
Yep. And that's it. But
Right.
maybe make it go a little deeper.
Yes, exactly.
Lisa Gerardo, thanks for everything and for your time. I appreciate it. I've learned a ton, and I know our viewers have as well.
Great. Thank you.
Absolutely. When we come back, how you can help us get more great guests like Lisa on the Means Report.